now. So you made it to week 3. At this point, you should be getting organized with all of your other classes. You've gone through the syllabus, you've gone through the expectations, right? And you should be coming up with a game plan, time management plan, organizational plan to get through this term. Right?
I will be once I'm done. I'm gonna take
What?
my quiz.
Don't anybody take
I'm
the
sorry.
quiz. Don't take the quiz
Oh,
before.
oh no, I was talking to my boyfriend.
Oh. Yeah,
I'm
don't
sorry.
anybody take the quiz. We take that as a group after. Okay? That's why I don't open it up till right before class. Yeah. Okay, still people coming in. You guys do have access to quiz too, right? I think I turned those on this morning. Okay, just still trying to get everybody in. So be patient. I don't want to miss anybody at the cutoff time, so or have anybody be sitting in the waiting room. So I'm just focused on that right now. And if everybody could, as far as your cameras, I heard from Jacaria that she's having technical issues, but everybody else, if you could turn on your cameras and make sure I can see your faces. I'm looking at several ceilings and walls. So I need to see your faces. Please.
Be monitored or recorded for quality assurance and training purposes.
Are you monitoring me for quality assurance? Okay. 31 people were still missing quite a bit, but I'm going to get started.
I'm gonna run to the restroom real quick.
Of course, of
Okay.
course, of
Right.
course. And then the group at, let's see, Natalia, Joanne, if you could turn your cameras on, please. Have anybody else that needs to turn their camera on?
I'll be right back. I'm also going to use the restroom really quick.
Okay. All right. Okay. Okay. Jacob's using the restroom, so just making sure I can see everybody. Nearest and Ackerman. Sorry, still letting people in. Are you guys just finishing up with another class? Right
Yes.
before this?
Yes.
Yes, med search.
Okay. Good to know. All right, I'm gonna get started. All right, so welcome to week 3. This is the last week of content before you guys take your exam next week. In this week's announcement this weekend, I'll post about the exam. I don't open up the exam to be downloaded until an hour before the exam. That's the protocol now. So I'll send you an email next Wednesday. I'll be taking the exam at this time online in class, unless you decide that you want to take it on campus with a proctor. Okay, so if there's a group of you taking it on campus with a proctor, I need to hear from every one of you. Okay, you can't speak for the whole group because I have to confirm that with the dean and your proctor of who's taking the exam. I have no, pardon me, I have no problem with you taking it on
Yeah,
campus.
make us. I'll call you back, but I got
Oh.
your stuff. I'll see you on campus tomorrow, okay?
Pardon me?
All right.
Anyway, about taking your exam on campus, I have no problem with that. But the protocol that I went through in week 1 is I need at least 72 hours notice. Okay, to get it organized and make sure it's okay with the dean and identify the proctor and get that proctor the information. So you guys take the exam on Monday. I need to know no later than Monday morning what your plan is for Wednesday. Okay. And again, if it's a group of you, I need to hear from everybody individually.
Did you say Monday morning? Because we have Med Search 2 class on Monday morning.
Well, then I need to know over the weekend or by Friday. Whatever, it's 72 hours. So Monday morning is actually 48 hours, right? And so best to organize it in the next couple of days if you're going to be taking it on campus.
Oh, no, I'll take it home, but I'm saying like, if you're taking it home, will it be Tuesday, same time? Or, because on Monday for Richmond campus, we have Med Search 2 lectures in the morning from 8:30.
I'm only asking you to contact me if you're going to be taking the
Oh, okay,
exam
sorry.
on campus with a proctor.
Okay, I'm sorry about that.
No, that's okay. If you're taking it online, like now, like you are now, then no need to contact me. It's only if you're taking it on campus with a proctor.
Okay.
And that, well, I don't know. That means everybody needs to talk to you, or because we need to
Everybody, I need to hear from every individual. I know I have a lot of Essington students. A lot of Essington students take it on campus. I get that. But I need to hear from every one of you. Like Chris, you can't speak for 8 people because I need to clarify with each individual. Okay. So
email. How do we? So we need to tell you. Everybody needs to send you an email, or
yeah, I need you to send me an email
On Outlook.
for documentation
On
purposes.
Outlook.
Pardon me?
Where would you like us to email you? In Outlook, Canvas, or whatever.
Yeah, my email is on all the announcements, and it's
Okay.
in instructor page. It is kmarvel
Okay.
at fortiscollege.edu. Kmarvel. All right.
Thank you. Yes.
So if you're going to be taking it on campus, let me know.
Okay. Thank you.
You're
When is the
welcome.
exam? When
Yeah.
is the
What?
exam exactly?
Pardon me?
When do we take the exam? What day and time?
During class time?
Oh, next week?
Yeah.
Oh, okay.
Yeah.
I just wanted to clarify. Sorry.
No, your exams are during class time, right? Week 4.
Okay.
All right.
Okay.
And then as far as content for next week, it's week 4. You'll be taking your exam. So in week 5, I'll cover weeks 4 and 5.
Okay.
I mean, I'll still send out an announcement with regards to week 4 content, and you're responsible for it, but we'll have to cover it in week 5. Alrighty? And then I'm hoping to send out groups by the end of the week, so you can start working on your week 7 project. That's due so it's week 3, so you'll still have plenty of time to get that done. I just don't want to overload you at the beginning. Okay? What else do we have to talk about? You all should have the blueprint review guide. Okay, that's for exam 1. If you want to call it a study guide, that's fine. But I call it a blueprint exam review because I am using the exam blueprint of concepts and organizing it that way. Okay, so each topic on your guide, each header that's highlighted in yellow, it follows right along with the syllabus for the last 3 weeks. Okay, we've got 4 concepts in week 1, 3 in week 2, and 3 in week 3. Okay, and it follows along exactly on the left-hand column of your syllabus what those are. Introduction to Community Nursing, Healthy People 2030, Introduction to Vulnerability. I forget what the other one is. Last week was school nursing, growth and development, all the common childhood ailments. And then today we're going to cover migrants, rural population, and these are special vulnerable populations, rural, migrant, and then homelessness/poverty. And that's it for the content. Okay, so your guide follows along with that. I did a review this morning and I had good attendance. I was pleased with that. I think I had almost 20 people. So yeah, whoever came on this class, thank you. Thank you. I hopefully it was helpful to you. I've just posted the recording. It's in your announcements.
I do just want to say I would have been there, but I had class at 9 this morning, or I would have been there myself.
No.
I'm sorry.
Yeah,
No
me
worries.
too. I had class as well.
Okay, so you have at least the first recording, okay? For me. So I believe it's tomorrow, Professor Ford does hers, and Sunday, Professor Kershaw does hers. I'd have to look at the schedule, but I think it's Thursday and Sunday. And I reattach that schedule to you in the weekend announcement. So you have it. All right, so you still have 2 more opportunities to go to a live review. And then as soon as they do their review and get me the recordings, I'll post them. Okay, just like I sent both of them my recording from this morning. Okay? So you have 2 more live reviews and you'll have 3 recordings. Okay? And we're all going through the same information. You know, we just have different styles in the way we present it. Okay? Questions? And I'd like to remind you that if you have issues with math, please go back to week 1, the announcement that I sent you. I think the header is math resources. Okay, Professor Bogart, who is a pediatric instructor, has a YouTube training video that is basic math. And in that announcement, there's some worksheets that go along with it. So if you need a math review, go back and look at it. It's an excellent, excellent tutorial. Very basic, very easy to follow. Okay, so that is in week 1, if you need help with that. All right. My suggestion, real quick, the group that attended the review this morning has already heard this, but my suggestion for preparing for the exam is to start with the blueprint review guide that I sent you. Okay, that is an abbreviated summation of the last 3 weeks of blueprint concept notes I've sent you. Okay, I put that together from several places. Okay, your notes for the last 3 weeks that you've received, your readings, and lecture. Okay, so I don't need you to go anywhere else. Okay, if for some reason you go through the review guide and something is not making sense, or you feel like you don't quite have it all covered, go back to your notes for the more extended version. And then if you still need some additional information, go back to your readings. Okay, I don't want to make this difficult. Okay, it's everything, all the dots are connected. From the readings to your weekly notes to the review guide. Okay? You shouldn't be surprised. There should be no surprises. Okay? With regards to the exam next week, if you have a really good understanding of the review guide and you can apply that knowledge for clinical judgment, you'll be absolutely fine. The exams, well, we're going to do quiz 2 today, but as you saw with quiz 1, the questions on the quiz are clinical focused, are they not?
Yeah.
Absolutely. All right. So the next gen format is taking your knowledge and putting and applying it to critical judgment. And that's exactly what quiz 2 is about today. They're clinical questions. And remember, I told you in week 1 that this class is very med-surg focused. Okay. So that's what you need to be thinking when you're going through that review guide. How do I apply? Let's see, school nurse. If you have a question about the school nurse, okay, it's fine to know about your, let's do common childhood ailments. By the way, there's a question, if not 2, on every one of the common childhood ailments. That's why it's on the review guide. Okay, so just FYI. Let's take asthma, for example. Great, you have 6 or 7 bullet points about asthma on your guide, review guide. What kinds of clinical questions might be asked about that information provided? That's how you need to think. Okay, for scabies, you have, I don't know, 4 or 5 bullet points. So it's kind of, it follows along how you did your discussion questions last week. All right, what are the signs and symptoms? And what are the teaching points? Does that make sense?
Yeah.
So it's fine to know about it, but can you recognize those symptoms and be able to figure out what's going on? All right, so that's all I'm going to say. The exam is clinically focused. Take your knowledge, apply it in practice. Okie dokie?
Yep.
I can't be any more clear about that. That's how your quizzes are, and that goes right into the exam. You guys will be fine. You guys will be fine. You'll be fine. If you put in the effort to study that review guide, have an understanding. After today, we'll go through the few special vulnerable populations. Everything on that review guide should be familiar to you. If you've missed a class, or don't take this the wrong way, but if you haven't been paying attention or you've skipped out, go back and look at the recording for that section that you missed. Okay? All right, questions before we get to week 3 content, and then we'll do our quiz. The other thing I want to bring up is after this week, let me share my screen, sorry. After this week would be a good, and in preparation for your exam as well. After this week, since we've covered a third of the weeks 1, 2, and 3, this would be a good time to stop and fill in the boxes that you can, that we've covered. Make sense? All these vulnerable populations we're covering. There's lots of information on here you can fill in. Or some, I wouldn't say lots, some. We're only 3 weeks in, but you can fill out some of this. So that would be my suggestion. Okay? I think I pulled up I was just talking about your exam study guide. Okay? I've given you all so you don't have to go back to the syllabus. I've copy and pasted all the readings for the first 3 weeks if you need a quick reference back. Okay? And all your highlighted topics follow the concept maps on the left side of your syllabus. All right? So let's talk about the special vulnerable populations we're covering today. What do we know about, what do you guys think about when you think about migrant farm workers? What do you think about? What comes to mind?
Exposure to like chemicals.
Mhm.
They're very known or very exposed to sun exposure. Like Samantha said, pesticide exposure.
Mhm.
I think it's like poverty, like
Mhm.
food wise, health wise.
Yeah, I think language and cultural differences because they're migrants. Not all of them understand English, can speak or understand English.
Which presents a lot of problems.
Yes, ma'am.
Yeah.
I think that they'll need, most of
Yeah,
them
poor health
will need to most of them will need to seek medical attention because of all the exposure they're going through.
Okay.
Most of
about?
them,
Go ahead.
sorry, most of them will probably have chronic illnesses because of their lack of communication skills and lack of being able to have the um resources for healthcare.
Mhm. What about mobility? Moving around with chronic illnesses. What about the kids who work on the farms? What about the housing conditions? What about the
Yes, because
communicable?
some of the kids do have to quit school early to help work
Yep.
out in the farms and do things for their family to try and provide support.
Yep. Yep.
And
So-
when it comes to, well, I'm sorry, when it comes to living conditions, if there's a huge population in the house and everything, there is also very or prone to getting certain diseases like tuberculosis, etc.
Absolutely. Hepatitis, tuberculosis. Yep. Yep. So we know that I'm just going to briefly summarize the notes. We know that they come to the US and work on primarily farms, right, during the seasons and then go back home. Or they move to another geographic location and do the same thing, right? They move around a lot. Like you guys have said, they typically, whether it's a education barrier, a knowledge barrier, a language barrier, they typically don't really know what services they have available to them. Lots of different cultures, lots of different languages. Okay. They typically have issues with transportation. They don't typically have private vehicles. Okay. Female migrant workers, we know, have a higher risk of sexual harassment or abuse and abuse. And then the kids are maximally exposed working on farms. Sun exposure, injury from equipment or vehicles. Okay. And one of the biggest risk factors for migrant workers is pesticide exposure. Okay. So we do know that pretty much our food supply in the US would collapse without the work done by these migrants, right? They're kind of the unseen, unheard members of society. Would you agree?
Yes.
Absolutely. Right? It's estimated that 2 to 3 million of these workers work at our farms seasonally to get the food to the market for us. Okay. These jobs don't come with health insurance, dental insurance, eye insurance, like we get through our employers, workers' comp, disability, retirement. These are hourly or daily paying jobs, right? So they don't want to miss work. If they're sick and they have to travel, are they going to travel to the nearest facility and miss a whole day of work, miss a whole day of pay? Probably not. Okay, we talked about housing, substandard housing, sanitation issues, maybe structural issues, a lot of people living in the house, maybe there's mold, lead, broken appliances. Okay, some of our migrants live in cars and tents. Crowding is, housing is overcrowded. And like we said, contributes to potential risks for GI issues, TB, hepatitis. Okay, we talked about the pesticides and high risk of injury, especially to kids with regards to equipment and farm tools and vehicles. One of the big issues with migrants is chronic health conditions, okay? Right? Migrants are typically at risk for chronic conditions, diabetes, poor dental health, obesity, depression. And the kids, what are they exposed to? They're much more at risk for malnutrition, infectious diseases, dental issues, maybe inadequate immunization, and maybe they're moving around from location to location, so their school schedule is interrupted. Their academic progress is impeded. So kids have a much higher, I mean, migrant workers have lots of risk, but kids of migrant workers have extensive risks. Does anybody know about the Migrant Health Act? So this is good. Okay, this Migrant Health Act doesn't get to everybody, but it's a start. Okay, it provides primary and supplemental health services for migrant workers. And this is done in outreach clinics. Currently, these are federally funded. Currently, there's 154 migrant centers in 42 states, serving almost 3 million people. But this is only serving a small minority of people, right? Think about it. What if you're not in one of these states? What if you're not located near one of these clinics?
Would that be something like the ones that are non-for-profit? Is that what that is? Does that fall into that category?
Well, if they're federally funded clinics, yeah, they're nonprofit.
Okay.
Yeah. So, in summary, farm workers have the following health risks. Pesticide exposure is the biggest one. Heat and sun, hazardous tools and machinery, infectious disease, maybe some musculoskeletal injuries from lifting all day, respiratory illnesses from pesticide exposure, maybe skin disorders, eye injuries.
Mhm.
And what we do know is there's very high rates of depression, substance abuse, depression. Okay. And then the kids on the farm, exposure to pesticides we talked about. Okay. I have this highlighted in green because I want you to know the difference between if you are presented with a question on the exam about somebody presenting to you with symptoms of pesticide exposure, what's the difference between acute exposure and chronic exposure? Okay. Acute, memory loss, difficulty concentrating, mood changes, abdominal pain. You can read through this, but chronic, this is over the years, chronic pesticide exposure. Okay, birth defects, cancer, blood disorders. So you need to be able to identify the difference between acute symptoms and chronic symptoms. Okay? Any questions about migrant farm workers, or do you want to add anything? What do you think about when you think about rural populations? Does anybody live in a rural population or have family or friends that live in a rural population? What's it like?
My a lot of my family lives in North Carolina in a small town. They're like 45 minutes away from like any grocery store, any medical attention, anything like that. So, and that's basically what rural population is someone who's very secluded from society, very to themselves, like maybe like a cabin in the middle of the woods or like a farm like 2 hours away from any civilization type deal.
Okay.
They're most likely to get, they're most likely to get ill because they probably don't have access to healthcare. Maybe they're far or the communication, the electric, it's just they don't.
Mhm.
Yeah.
Do we think there are more or less services or resources for them?
Yes.
Less, right? They're
Mhm.
not going to have a high-risk OB doc. They're not going to likely have a pediatrician. They're not going to have an oncology doctor, a neurologist, a surgeon. Very limited resources. In a lot of communities, it's simply a family physician that takes care of the whole community. What if you're a rural health nurse? I mean, you may be, yeah, you may be the school nurse, you may be the clinic nurse, you may be the immunization nurse, right?
Mhm.
I mean, think of all the tools you need as a rural health nurse. No backup. Your backup may be a phone call away to the next big city. Okay, so rural can include remote living, like we've talked about, maybe a farm or a small village or a small town compared to the larger metropolitan areas. In the last decade, there's definitely been a shift from people moving out of the cities into the rural areas. Okay, but that comes with a lot of vulnerabilities. Rural populations have a lot of vulnerabilities. Okay, typically the demographics are either below 18 or above 65. They have fewer years of education, obviously fewer college degrees, and it's estimated that 25% of rural Americans live in poverty. And in turn, 40% of rural kids live in poverty. Okay, some of the biggest demographics that are at risk are racial and ethnic minorities, single parent families that are led by females. And then similar to the migrants, few residents have insurance. They're either uninsured or underinsured, which presents problems. We know that
That would also carry on to the children, right? If they're
absolutely,
underinsured like that and they have a child that has a genetic disorder or has a medical
yeah,
issue with transportation.
yeah. We'll talk about that. That's coming up. Yeah. So think about, when are we likely to see, when are we, well, let's take a step back. Rural population is really not focused on their primary healthcare, right? They don't go to their well visits. There's really no pediatrician for annual, kids visits. Okay, they're much less likely to engage in their preventative activities. They're more likely to smoke, have higher rates of alcohol use, obesity, less likely to engage in their annual screenings. Okay, they're much more likely. Rural population, the significance of chronic illness is profound. COPD, hypertension, arthritis, diabetes, cancer. It's estimated that nearly 50% of all rural adults have some kind of chronic disease, as opposed to 25% in the larger cities. That's huge. Okay, when are we typically going to see them? When they're sicker? Yes, because they haven't been screened or done any primary or secondary preventative measures, right? When they get sick, they have more difficulty maintaining their independence because of, number one, transportation. There's very little public transportation in the rural settings, lack of services we talked about. And then the distances between, if they need oncology support, maybe the closest facility is 2-3 hours away. So there's a lot of challenges. Okay. We also know that in rural populations, there's a much higher infant morbidity rate. especially with docs with areas that have poor OB coverage. As we talked about, they lack pediatric or OB specialists. So if you have a high-risk pregnancy, it's not getting taken care of in your rural community. Okay? Rural residents have a higher rates of mental health issues. We talked about that. Depression, anxiety, substance abuse. Poverty is very prevalent in the rural areas. There's 4 major industries within the rural population that have the highest risk for vulnerabilities. That's forestry, mining, marine related fields, and agriculture, the farms. Why? What do you think? Machinery, vehicle accidents, trauma, cancer, allergies, respiratory illnesses, maybe birth defects from long-term exposure to the pesticides. Okay. And if kids are born to parents that during their pregnancy were exposed to the herbicides and pesticides, there's lots of risks that go with that. Right? Complications at birth defects, maybe stillborn, miscarriages. So that's why we list the rural population and migrant farm workers as a special vulnerable population. But they are part of a community, right? If you don't live in a rural community, you probably tend not to think much about rural communities, right? But it's part of all communities are part of public health and community health. So we do need to think about them and think about the challenges. One of the things that's increased and is better now with the rural communities after the pandemic is telehealth. You're able to do a lot of your visits over the phone, but another barrier for rural population is internet.
Yeah.
You know, we think of internet like, just jump on your phone, jump on your computer, internet. No, it's not that easy in these rural communities. So obviously, if you don't have internet, you can't do telehealth. If you think about it's difficult to find staff for rural communities. The travel. Okay. Home health visits. You know, somebody's not going to drive 3 hours from the city, a nurse, to do one visit. Right? So lots of barriers. Lots of barriers. Anybody have any questions about the rural population? The last population is homelessness, poverty. What do you guys think about when you're driving down the street or walking your dog or riding your bike or riding the bus or whatever, and you see a homeless people or a homeless encampment? What do you guys think?
How they got, like, what caused them to get to that point is my
Mhm.
first thought.
Mhm.
I don't think of that. I just feel bad. But I used to work for the DCF, which is a food stamp office. And it's really hard because the homeless had a hard time, even though they qualified, they had a hard time when everything went over electronic because they had no mail. So they couldn't get the card sent to them, and the post office didn't want to handle all the general delivery mail.
Mm.
That
Hmm.
Most of them are old, so I'm thinking maybe they ran out of retirement benefits. Maybe.
Also, like, tends to have like a kind of like an underlying condition, like a mental disorder.
Mhm.
PTSD is very common for veterans, or very common to be homeless. Substance abuse, probably physical, sexual abuse at the home tends to also be a lot of underlying conditions.
And I think Lorna just mentioned that it's an older population. Yes, however, the increase in families and children being homeless is huge, especially since the pandemic. All right, so
I saw a whole family on the street the other day.
Oh,
Husband, wife, and 2 kids and a baby in the stroller.
yeah. Yeah, I mean, one of the things we have to do as nurses in working with this population in particular is have our own feelings in check, right? Non-judgmental,
Yeah.
compassionate, kind. Everybody has a story. The great majority of these people, whether they're individuals or families, they don't want to be in this situation. Sure, there are some people that want to be, they're okay, whatever. But the great majority of people do not want to be in this situation. They want to be lifted up and out. And so if you're a community nurse and you're particularly working with the homeless, you've got to have your own feelings in check. Okay. So interestingly, before COVID, before the pandemic, the number of Americans living in poverty was the lowest since 1959, 10%, 10.5%. After COVID, it climbed to 17.3%, 48 million Americans. And the child poverty rate jumped up to 21.4 of 5 million. And I can tell you, I saw this firsthand in the schools. Okay. I worked not just in one school. Our model in the big district I worked in was a consultant. We covered several schools. So I had 10, 12 schools. Saw this consistently in every single school with the effects of the pandemic. Of families becoming homeless, families going into poverty, families having to move in with friends, relatives. Parents had to quit their jobs to stay home. So
And
kids
that's one
were
of the
home.
times, with the COVID is when it really hit a lot of our veterans that suffer from PTSD emotionally.
Exactly.
I'm saying because my husband's a veteran and it hit him very hard during this whole COVID, having to readjust to the living and being isolated. It just brought on a lot of depression for some
Oh.
people.
Yeah. Thanks for
And
sharing. Yeah.
most of them, like, even if they, for example, if they get sick and they go to the hospital, they don't want to leave because they don't know where, they don't want to go back to the streets. So
They don't have a place to
it's so
go.
hard because most of the facilities or hospitals have rules. They can't keep you there after they're done with your treatment. So
And homelessness doesn't necessarily mean you're simply living on the street. Homelessness is also defined, and this is where I saw a lot of these cases in the schools. It means you don't have a permanent place to live. So even if you're living with a relative or a friend, it's temporary.
right.
And so temporary is considered homeless. Okay.
Mhm.
So there's a lot of definitions of homelessness, but our federal government determined this section is about both homelessness and poverty. So our federal government determines what the poverty line is, or the federal poverty line every year. And so if you qualify for a family or individual living in poverty, there's lots of resources for you: public housing, food stamps, Medicare, WIC, right? However, if you live even slightly above the poverty line, what happens? Most of those resources go away and you become very, very vulnerable. So even if you're living slightly, that's why there's a particular number figure. If you are at the 24.3 or below, you qualify for all these services. If you're at 25, you don't.
Mm-hmm. Yeah, because I used to work somewhere and someone was going to get a raise. She said, no, I don't want a
I don't
raise.
want the raise. Right, right.
Because you know once you get the raise, then she's gonna be $500 above what? Then she
Exactly.
on the raise. Just let me be. I was like, why you don't want the raise?
Mm-hmm. Oh,
He's like, better
Yep.
that you get more. Then
Mhm.
just $100, then you're above. Then they stop everything.
Yeah. Yeah. Poverty, poverty. Really, the definition of when we describe people living in poverty or people poor, it means you have insufficient resources to meet your basic needs. Okay, the basic needs we're talking about here: food, shelter, transportation, and healthcare. So obviously, if you're poor or living in poverty, there will be issues with food insecurity. There may be issues with food insecurity, maybe issues with housing and shelter, transportation, and maybe access to healthcare. Okay, and then take that situation and imagine it being in the rural community when there's not grocery stores, not a lot of housing options, no public transportation, and extremely limited access to healthcare. Okay, what contributes to poverty? Unemployment, loss of retirement benefits, somebody said, when a company closes or files for bankruptcy, and employees lose their retirement fund. We already said that increase in female-headed households contribute to poverty. Maybe there's inadequate education, inadequate school system, job training, weak enforcement of child support statutes or laws, outsourcing of jobs, numerous, increase in the number of kids born to single moms, particularly teen moms, right? And what does poverty lead to? Lots of things: chronic stress, mental health issues, high rate of chronic illnesses, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, more significant disability, whether that's adults or kids related to the chronic disease, higher rates of hospitalization. Complex chronic health conditions is the #1 expense in healthcare for the country. Chronic health conditions. We already talked about the inability to have insurance or pay for healthcare. Okay. We know that young kids are at the highest risk for effects of poverty. Okay, so if you get a question about who is the most at-risk group, is it an elderly person? Is it a child? Is it a middle-aged person? The child always trumps everybody. Everybody's at risk, but the children are at the highest risk. So remember that, please. What kinds of effects for the kids? Nutrition leads to poor brain development, exposure to toxins, trauma, abuse, maybe lower quality of daycare. And these kids we saw this in the schools. They have nutritional deficiencies. They have growth and development issues, developmental delays. Some had higher elevated blood levels, more infections, ear infections, throat infections. And they too are more likely to be stuck in the poverty cycle due to their decreased opportunities in their community. And here's
it's really
ahead.
unfortunate. I'm sorry. It's unfortunate because with these types of populations, even though they don't have the means to take care of themselves or be able to move forward to try and do anything for themselves, a lot of them get stuck in the system with DCF, with child abuse reports for negligence. And that's another thing that
Yep.
that has a toll on these people.
Absolutely. Excellent point. Excellent point. This is something I would like for you to remember about teens. Okay. Poor teenagers, poor adolescents are likely to have below average academic performance, academic skills. And even more importantly, this group is 3 times more likely to drop out of school. Okay. There's higher rates of teen pregnancy. Teen pregnancy, they're going to be more vulnerable and having complications. Maybe they're not seeking prenatal care. Right? Maybe they end up with a low birth weight infant or preemie. So think about this. If you have a teen pregnant mom you're working with, one of the most important things that you can teach and hopefully have happen is that teen mom needs to stay in school. Obviously, she needs to get to prenatal visits and eat healthy and all that. But more importantly, priority wise, she needs to stay. You have to try and keep her in school because we know that education will give them a better opportunity to make better decisions. Right? Okay, as far as homelessness, a lot of it's the same. What leads to homelessness? Unemployment. There's no regular income, so they can't keep their home. They can't afford rent. They've lost access to health care. Do they have a disability? Some become homeless because they have chronic physical or mental illnesses that they can't hold down a job, right? They don't have strong social support groups or resources. Somebody mentioned the homelessness, not knowing about the resources that are available to them. Substance abuse can lead to loss of job, financial difficulties, right? When your addiction or your substance abuse issues become the primary focus above your job or your family, that's an issue. Domestic violence, women wanting to get out of the home with their kids, they want to leave a relationship. They have nowhere to go but the street. We already talked about homelessness also includes those in the street, but staying with friends and relatives, staying in temporary shelters, staying in institutions. They have nowhere to be discharged to. It's temporary. Okay. And then the homeless, what are they exposed to? The ones that live out on the streets, the elements, the heat, the cold, the crowding, unsanitary living conditions, nutrition issues, lack of proper sleep, chronic stress. Already talked about they're much more likely to abuse substances, have serious mental illnesses, infection and communicable disease risk, transmission of say TB or skin infestations, chronic illnesses, crime, trauma, all increase dramatically with the homeless population living on the streets. So what do we need to do? Well, here's an interesting statistic. The average life expectancy of a homeless individual is 44, as opposed to 78. That's pretty radical. Okay. So nurses, what can we do? I started this at the beginning. We respect the individuality of every person. Many factors contribute to homelessness, and many of us are only 1 to 2 paychecks away from being able to maintain our basic needs. It's super easy to stereotype and be judgmental, but often we're wrong.
Mm-hmm.
Right? And if we are stereotypical or judgmental, that's going to ruin any chance in developing a trusting relationship with this group. The most important thing we can do as nurses is first establish trust. The homeless population is a group that doesn't really like to talk about their story, but they will. Right? If you can establish that therapeutic relationship, especially with the families, with the kids in tow, can you talk the mother into getting the kids into the pediatrician for appointment or immunizations? Okay, they all have a story to tell. Let them learn to trust you and let them tell their story. Then you can help guide them to whatever resources they need. Okay. The last part of this is a mixture, some examples of primary, secondary, and tertiary interventions that span all three topics we covered today: migrants, farm workers, rural population, and the homeless and clients who live in poverty. So let's go through these, because you need to have an understanding of these. There are always several questions on every exam about primary, secondary, and tertiary. And I can tell you they're clinically focused. So a family presents to you with a kid with asthma. Can you identify which answer is a primary intervention, which answer is a secondary intervention, which answer is a tertiary? Okay, so you're going to get asked questions about these prevention levels. So primary prevention. So here's some examples on what we've covered today. Teach ways to avoid pesticide exposure on a farm. Everybody understand why that's preventative? Advocate for immunizations in a migrant farm worker with children. Advocate for better living conditions of rural migrant farm workers to prevent crowded living conditions. Understand why all that is primary? We're trying to prevent something before it happens, right? Secondary screening, okay? Early intervention, early identification. Screening for evidence of financial instability, right? Especially those with chronic health conditions. Can they afford their care? Can they afford their medication? Can they afford their equipment? That's a screening process. Do they do yearly blood pressure checks, A1C checks for diabetes? Educating them on the importance of scheduling their annual screenings, cancer screenings, pap smears, colonoscopies. Okay? Everybody understand why those are secondary? We're trying to identify risk so that we can try and reverse course before the condition is an actual diagnosis and gets to tertiary, right? So here's some examples of tertiary. Providing guidance on management of lower back pain, either pharmacological or non-pharmacological, right? So they have a diagnosis, lower back pain. So you're educating them and working with them on maybe how to manage their back pain. Okay. Helping a homeless client find and apply for resources. They're homeless. That's the issue. That's why it's tertiary. Right? Referring to the health department for treatment of HIV or STDs. Why is that tertiary?
It's because they already have the disease.
They already have an STD or HIV. Teaching a client how to take their medications. They're taking their medication for something. So they have something. How to find low price cash pay medications. Maybe you've identified them as living in poverty. That's the issue. So they already have something going on. Do those make sense to you?
Yeah.
You guys with me?
Yep.
Yes.
Yes.
That's an overview. I mean, you don't tend to think of these population, well, you don't tend to think of the migrant farm workers and the rural populations if you don't live in those areas. But like I said, they're part of our community. Someday you might find yourself living in a rural community and maybe working in a rural community. Okay. All right. So let's see. It is 3 o'clock or 1:57, 2:57. No, I'm on the
One-
East Coast. No. It's
1:50.
2 o'clock. It's 1:58. I'm on the East Coast. Sorry. So let's take 17 minutes, 1:58 until 2:15 to do quiz 2. Okay, 17 minutes. That should be enough. There's 10 questions. Take your time. You have to stay on camera. This is considered a key graded assessment, so it has to be proctored like an exam. So you got to stay on camera. And when you're done, you can move away, whatever, but I need everybody to submit when they're done before we can go over it. And at 2:15, we'll go over it, the quiz. So just take your time. They're clinically focused questions. Think about what we've just talked about with these 3 special vulnerable populations. Okay? And you should all have access to it. So I'm going to mute myself. Okay? Patrick, I need you on camera. Everybody else looks good. Thank you, Patrick. Mildred, I'm looking at your ceiling. I need to see you. Thank you. Melody, I'm looking at your ceiling. Can it pull your camera down a little bit? Thank you. Okay. All right. I'm going to mute myself. Take your time.
We're starting the quiz now?
Start the quiz. Yes.
Okay.
Yep. But you got to keep your camera on. Okay, we've got about 3 more minutes, okay? And please hit submit when you're done. Okay, everybody done? So anybody that's still working on this? Okay, if everybody could turn their cameras back on. Okay,
I'm sorry I logged off. The lights went off and I had to connect my laptop's
Okay.
internet to my dad's phone to continue with the quiz. I don't know what's going on. It's a lot of reconstruction.
okay. No worries. One second. Okay. All right, let's go through the quiz. How'd you guys do? How'd you do? Sorry for the background noise. Okay, let's go through it. What? Oh, I'm sorry. Go ahead.
Said we better than last time.
What?
I said
What?
we better than last time.
Oh, good.
Yeah.
I need to make sure everybody is submitted. Okay.
Okay.
All right. All right. So go ahead.
Miss Marvel,
Yep.
I'm about to join. I'll be on here with 2 devices because this one is faulty. So just in case one logs off.
Okay. Okay. What should the home health nurse anticipate about clients in very rural areas? I'd be surprised if anybody got this wrong. What's the right
Chronic
answer?
illness.
That's
Chronic
one.
illness.
I'm
First.
flexible on this.
Get out of my face.
A.
I'm sorry.
They're more likely to have complex chronic illnesses. Why?
Because of the income,
Because of what?
Because they're not getting medical care.
enough money.
Lack of access?
Lack of
Yeah.
access to medical care.
Yep. Lack of insurance. Okay. Number 2, the nurse is developing a primary prevention program for members of the rural community. Which intervention is appropriate?
Provide information on minimizing
exposure.
Correct. What's A?
It's
Is
the
that secondary?
Secondary.
secondary.
What's C?
Secondary.
Nope. Tertiary. Why?
Tertiary. Oh, because they already have.
Because
They
you're
already
teaching
got
them.
diabetes.
Okay.
They have diabetes already.
Yep. What's D?
Secondary.
Excellent. Good
Yeah,
job. Good
secondary.
job. So, a migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation and throat irritation and cough. Which nursing intervention is appropriate? What are those signs of?
Pesticide.
Pesticide.
besides.
The second
Yep.
one.
Potential pesticide exposure, and that's in your notes this week. Remember that green paragraph I highlighted? Knowing the
Yeah.
difference between acute and chronic. Okay? During a home visit, the nurse notes that a migrant farm worker is living in a small house with lots of families. Which nursing assessment is a priority? This is a good example of a question that is not a select all that apply, that maybe might have more than one correct answer. So what would you do in that case? You would go
Tuberculosis and
go
Tuberculosis.
back and look at the question to see if you missed a key word, a key phrase, a key cue. So this question asking, what is the priority? What's the answer?
tuberculosis symptom screening.
Because several families live in a small space.
Right.
Yeah.
What's the risk? We just talked about it. There is a
Tuberculosis.
huge risk.
Tuberculosis.
Right, right. TB is the priority. Okay, priority. Which statement reflects the impact of income, so poverty, on health outcomes?
Low income increases
Low
the
income
risk of
increases the
chronic.
risk of chronic illness.
Correct. The others are the opposite. Okay, low income, poverty increases the risk of chronic illness. Again, lack of funds, lack of resources, lack of access. What should the nurse anticipate for a family living just above the poverty line? They're not in the poverty level, they're above it. What happens?
Just
Yeah.
gonna increase their vulnerability.
Due to fewer community resources.
Right. We talked about that. It's a fine line. You're either below it or you're above it. Doesn't matter if you're slightly above it. Okay? Which client is at the highest risk? Another important word, highest risk for developing adverse outcomes related to poverty.
The 13th month old.
I got this one.
Okay, we talked about this in class. I said to you, if you have a question like this, who is the most impacted?
The child. We
Oh,
said
the
kids.
child.
Yeah.
Yeah, you did
Kids.
that.
Kids are the most impacted. It's not, yeah, kids, just remember that. So which would the school nurse expect from an impoverished adolescent?
Increased risk.
Dropping out of
Yeah.
school.
What is it?
Dropping out
Increased
out of
risk of
school.
dropping out of school.
Exactly. Because the other three are the opposite. Okay, we talked about that. Very high risk for dropping out of school, 3 times more likely to drop out of school. Okay, which client is at the highest risk for homelessness?
The veteran.
The veteran.
Why? Why is it the veteran here?
He got post-traumatic disorder. He living alone.
He's living alone. Everybody else is living with somebody that can
Support them.
monitor,
Support.
watch, or report. Okay. And then the nurse is working in an outreach clinic at a homeless shelter. So it's giving you the location. So you have to think homeless shelter. Which needs to be prioritized?
The
Night
first one.
sweat.
That come them night sweats and that unexplained weight loss.
Why?
Because
TB.
yes, TB.
They, mhm.
Risk for TB and homeless shelters are at a much higher risk for TB. It's
Right.
not that the other 3 clients don't need to be seen. They do. But the question is asking priority. All right. So yes, yes,
That's
B
that
might
clinical, that's that clinical thinking.
clinical thinking. Yes, B might be working on an infection. I get it. It's important, but it's more important to get a hold of a TB outbreak if that's what's going on. That's why the question says priority, which is the priority. So this is a good example of another question that, there's a couple of answers that could be correct. However, it's not a select all that apply. What word did I miss? You misprioritized. Okay. Is everybody with me?
Yeah.
So all those questions are clinical questions. That's how your exam's going to be. Taking your knowledge, applying it to clinical judgment. Have I beat that into you enough today?
Yeah, a little bit.
Okay. So that's it for me. Did you guys learn something today?
Yes.
Yes,
Yeah.
ma'am.
Yes.
These
Yes,
are
ma'am.
populations that you're going to have to be working with in the community.
Yeah. So
Okay.
being with you twice today, that's a lot. That's good.
Chris, thanks,
Yes,
Chris.
ma'am.
I'll take that as a compliment.
Yeah, that's a good one. I think I
Okay.
want
Thank
I
you.
want more of you. Give me more. I want more.
Now listen, if you guys plan on taking your exam on campus, just reach out to me in the next couple of days. I just need your name and give me the proctor name. I'll take care of it from there.
Okay.
All right.
Okay, Chris.
All right. Listen, that's it for today. Have a good rest of the week. You have my recording for my review today if you want to start preparing. If you've got exams in the next couple of days, other than this class, focus on those. Okay, you don't take this exam till next Wednesday. All right. I'll stay on if anybody has any questions.
you.
I'm going to stop the recording.